Hi, my name is Sasha Guay. Thank you for taking the time to watch our presentation, The Athlete's Guide to Concussion, Recognizing, Understanding, and Managing Concussion. Our goals for this presentation are to help answer the question, what is a concussion? To assist in understanding concussion symptoms, recovery timelines, sideline management, and post-concussion syndrome. This presentation is geared towards not only athletes, but also sideline personnel, coaches, and parents to ensure that everyone involved in the game of hockey is empowered with knowledge about concussion. A concussion is also known as a mild traumatic brain injury. Unlike previous trains of thought, there are no grades or levels of concussion. A concussion is caused by an impulsive force that is transmitted to the head. This doesn't require a direct contact with the head. Many concussions can be caused by this force being transmitted through the body up to the head, such as falling abruptly and taking the impact with the hips and/or arms. A concussion is not a structural injury, meaning that we cannot see concussion with diagnostic imaging, such as a head CT or MRI, nor do we have any specific tests for diagnosing a concussion. The diagnosis of a concussion is made from signs and symptoms we see in clinic. The injury was previously thought to be due to the brain hitting off the insides of the skull, referred to as a coupe-contre-coupe injury. We now better understand that the white and gray matter that makes up the brain is made of different densities, which therefore accelerate at different speeds when the impulsive force is transmitted to the brain. This difference in acceleration speeds causes a micro-shearing force in the neurons, which alters the electrical signals that they fire. The electrical signals within the brain rapidly increases, which expends energy. This quick usage of energy causes what we refer to as a metabolic disturbance within the brain, and this is what results in the symptoms. 3 to 5 days following the injury is when the energy levels in the brain drop the most and usually results in the most intense levels of symptoms. It's important to rule out other causes of symptoms, such as a neck fracture, severe traumatic brain injury, spinal cord damage, etc. This metabolic disturbance within the brain is recoverable, however, is a vulnerable time of healing for the brain. If an athlete does not rest and recover appropriately while the energy stores replenish, they are at risk of a second impact syndrome, which is a severe and possibly irreversible injury. 2 concussions close together in time can result in the same irreversible damage as a severe brain injury. It's interesting to note that the amount of force that is required to cause a concussion is significantly higher than the force required to cause a mild brain injury. Therefore, if someone has a concussion, they also have a neck injury, which results in very similar symptoms as a concussion. Sports are the most common cause of concussion in the age groups of children, adolescents, and young adults. Hockey in particular is among the top 5 sports resulting in concussion in both men and women, and can occur in both games and practices. 22% of hockey players in Canada report at least one concussion by the age of 25. It has been noted that athletes with a history of concussion are at an increased risk of future concussion. It's often thought to be a result of physiological changes in the brain after a concussion. However, we also have to consider other things such as the type of athlete that's getting a concussion. Other features of the athlete may be to blame for the repeated concussions, such as their playing style, skill level, position, likelihood to report a concussion, among other factors. So what does a concussion look like when it occurs? Contrary to many people's beliefs, many concussions have no signs at all upon impact, and as previously mentioned, the impact does not necessarily have to be directly to the head. As the energy in the brain continues to deplete, the signs and symptoms can evolve over minutes to hours, and as mentioned, are often at their worst 3 to 5 days following the impact. Some concussions do have more obvious signs upon impact, such as lying motionless, motor incoordination, impact seizures, tonic posturing, which looks like their limbs are going rigid, floppy upon impact, or a blank or vacant stare on their face. Some of the most common signs and symptoms seen with concussion include a headache, pressure in the head, neck pain, nausea, vomiting, dizziness, blurred vision, balance problems, sensitivity to light, sensitivity to noise, feeling slowed down, feeling like they're in a fog, reporting that they don't feel right, difficulty concentrating or remembering, fatigue or low energy, drowsiness, trouble falling asleep, more emotionally irritable, sadness, nervous, or anxious. There are 3 forms of concussion prevention. First is primary, preventing the concussion from occurring in the first place. Improving player skill and game awareness reduces the chances of the player getting into a position that puts them at risk of a concussion. Concussions are more likely to occur when players are fatigued, and therefore reducing chances of fatigue and improving an athlete's fitness level reduces the risk of a concussion. Also, improving the equipment, rules, and environment lowers chances for concussion by facilitating a safer game for athletes. Changing equipment and rules in the game of hockey may not be very realistic. However, we can have control over the player's skill or game awareness, fatigue, and energy level. Drills that focus on puck control with the athlete's head up, focusing on positioning to avoid high-risk plays or passes, improving reaction times, and more are all important concepts that reduce risk of concussion. Concussions are also more likely to occur when players are fatigued, in part due to their reduced reaction times and also their lazier playing style. Therefore, working on fitness and endurance training helps reduce the risk of concussion as well. A number of drills can be modified to focus on these aspects. An example could be an offensive breakout drill with the focus of keeping the head up and being aware of peripheral surroundings. The goal of the drill could be to achieve a certain number of passes successfully without looking down. The difficulty of the drill could progress by increasing the speed of the drill, the number of turns the player has to make, the number of players involved, or the number of head turns they have to make throughout the drill. This would cause them to focus on peripheral awareness and reaction times. Healthy competition in practice never hurts to increase a player's buy-in. So you can motivate players a number of ways, such as splitting the teams into groups and acquiring points for successful runs, or things like push-ups for failed attempts. Something important to note for the players that are getting to the age or are at the age of playing with contact. Giving and receiving contact is a skill that requires practice. Just because someone's bigger than others on the ice doesn't mean that they have a reduced risk of concussion. Practice responsible body contact. Secondary prevention is preventing the worsening of a concussion. This comes from educating everyone involved in the game, conducting baseline testing, appropriately using detection tools, and clinically managing the concussion by seeing a healthcare professional, such as a concussion-trained physiotherapist. Some concussions are difficult to prevent from occurring in the first place. Therefore, understanding how to prevent the worsening of a concussion is a crucial component of concussion education. The hockey culture around concussion is improving. However, we still have room to grow. There is an undeniable tough guy or girl mentality where athletes are praised for brushing off pain or injury. A study on college athletes reports that athletes were significantly less likely to report a concussion if it was considered to be just getting their bell rung, and most likely to report it if it was considered to be a brain injury. It's important to note that the best people to detect someone's concussion and changes in their behavior are their teammates. There is a decreased chance of repeat injury with increased time taken to return to play. And fostering a supportive culture in the game of hockey is a key component to reducing the impact a concussion has on not only the athlete's return to play, but also their life. Finally, tertiary prevention is when our goal is to reduce the symptoms we already have and improve the outcome and prognosis. Clinically managing the concussion with a trained healthcare professional is the key to this type of prevention. Studies have shown that the most important factor for recovery from a concussion is how quickly an athlete is assessed by a trained healthcare professional. These studies show that the number of days between a concussion and the evaluation directly correlates with recovery times for a number of reasons. Athletes seen within 1 week of injury have been seen to recover 20 days sooner than those that wait 2 to 3 weeks to see a healthcare professional. Current research also states that recovery from a concussion is longer with repeat concussions, especially when they're close together, children and adolescents, females, pre-existing depression or anxiety, a lack of education following injury, higher initial symptom scores, and or poor coping strategies. Due to the volume of media coverage that is on concussion, a number of myths have come up around factors that impact recovery times. Some factors that we see in clinic that people believe impact recovery time but in fact do not include vomiting at the time of injury, loss of consciousness at the time of injury, amnesia, which means forgetting events before or after at the time of injury. A large study on concussion states that there have been inconsistent findings regarding whether specific injury severities such as loss of consciousness, retrograde amnesia, or post-traumatic amnesia are associated with greater acute effects or prolonged recovery. When an athlete has sustained an impulsive force to the head that could potentially result in a concussion, it is crucial that they do not return to play the day of the injury. Following impact, the athlete should be monitored for a few hours after injury. Avoid the use of medications to prevent masking of potential symptoms, and also be sure not to sleep for the initial 3 hours following to monitor for a potential decline in the athlete's health status. However, there is no need to wake the athlete up throughout the night to check on them, as we previously thought. Following impact, it is important to address more immediately threatening first aid issues and rule out serious medical conditions, such as injuries to the neck, neurological concerns, brain injury, fractures, etc. A licensed healthcare professional or physician could then assess the potential concussion using a tool called the SCAT-5. However, this is not required. If any signs or symptoms are present, a concussion should be suspected until proven otherwise. Studies on concussion have shown that the recovery time is shorter and symptoms are less significant in an athlete that is removed from play. It is also important to note that many symptoms that are correlated with concussion can also overlap with other causes. We should also note that no two concussions are the same. A history of concussion does not dictate what a second concussion will look or feel like. We can't rely on previous experience to tell us what our next concussion will feel like. A well-known saying in regards to concussion in sport is, when in doubt, sit them out. This is a list of things we consider to be red flags if they appear 2 to 3 hours after an impact. This means that if they appear, they should be referred to the emergency room immediately. This includes severe or worsening headache, seizures with no history of seizures, weakness in a limb, vomiting, decreasing alertness, changes in vision, tingling or numbness, difficulty speaking or understanding speech, difficulty swallowing, difficulty writing or reading, loss of fine motor skills such as tremors, loss of coordination, loss of balance or unsteadiness, abnormal sense of taste, loss of consciousness or cannot be awakened, decreasing level of consciousness more than 2 hours after an injury, fluid leaking from the ears, bruising behind the ears or 2 black eyes, and inability to remember more than 30 minutes before the injury. Briefly, I previously mentioned a tool called the SCAT-5. This is a sideline concussion assessment tool that trained sideline personnel can use to assess the potential for concussion. It should only be used with athletes aged 13 or older. Those 12 and younger should use the child SCAT-5. The SCAT-5 is more effective with baseline testing, but is not required. It should not be used by itself to rule in or out a concussion, and a concussion may exist if the SCAT-5 is normal. An athlete's result on the SCAT-5 normalizes 3 to 5 days post-injury, and therefore should not be used to determine someone's readiness to play. Brain energy levels recover in 22 to 30 days, which is considered to be physiological recovery. However, symptoms may resolve before this. In fact, approximately 85% of concussed high school athletes have no symptoms by 21 days. Therefore, no symptoms does not mean that there has been a physiological recovery or normalization of brain energy levels. This common misunderstanding may lead to an early and dangerous return to play. Returning before brain energy levels recover results in increased chances of greater brain injury and prolonged recovery. Symptoms alone are a poor indicator of recovery from a concussion. 2 well-known studies in the concussion space state recent literature suggests that physiological time of recovery may outlast the time for clinical recovery, known as symptoms. The consequence of this, athletes may be exposed to additional risk by returning to play while there is ongoing brain dysfunction. Another study states, while it was reported that self-reported symptoms diminish after a few days or weeks, it was found that objective deficits can persist longer than this. An athlete's favorite question following a concussion is, when can I return to play? An athlete may return to play once they have normalization of objective testing. This means that tests on things such as their balance, reaction time, cognitive ability, memory, visual processing, physical capacity, and more have returned to their normal levels. This would be assessed by a licensed healthcare practitioner, such as a physiotherapist, and is done by comparing post-concussive test results to baseline measures and, or if those are not available, evaluating an athlete's symptoms during testing. A topic of increasing interest in the concussion world is post-concussion syndrome, or PCS. It is a constellation of non-specific post-traumatic symptoms that may be linked to coexisting and or confounding factors, which do not necessarily reflect ongoing physiological injury to the brain. PCS is defined as persistent concussive symptoms that last more than 14 days in adults or more than 30 days in children. More than 30% of concussions will have symptoms for more than 4 weeks, which is considered to be PCS, if they do not seek treatment. The exact causes of post-concussion syndrome are unknown. However, 5 theories are at play. 1 is blood flow abnormalities. Our body's ability to regulate appropriate blood flow demands when we perform physical activity have been altered. Secondly, metabolic, inflammatory, or hormonal. So our ability to appropriately manage our metabolism, inflammation, or hormones are disrupted. Thirdly, visual and/or vestibular dysfunction. The eyes and inner ears are not functioning properly to give our brains appropriate input. Fourth is the neck. Injury to the joints or soft tissues in the neck are exacerbating or causing concussion-like symptoms. And lastly is psychological. The emotional response following a concussion can cause very physical symptoms. So what can a physiotherapist do for you? Our most important role is to educate athletes on concussion to prevent worsening or progression of symptoms and prevent future concussions. We determine causes of continued persistent symptoms with things such as exertional testing and neck, vision, or vestibular systems testing. We guide return to school, work, and play. We provide exercises to improve symptoms such as physical or cardiovascular activity, neck exercises, vision or eye training, balance training, and more. We rule out other potential causes for symptoms and refer to other professionals if needed. And ultimately, we get you back on the ice safely. So what should you expect if and when you come into physiotherapy for concussion? We'll take your history. There's extensive education, exertional testing on the treadmill, neck assessment, visual systems assessment, which is your eyes, balance or vestibular assessment, develop management strategies, and an ongoing reassessment and evaluation. Concussion is an extensive and complex topic. Educating athletes and team members is a very important step in improving outcomes. In summary, I'll provide you with a few take-home points, so if you tune into any part of the presentation, this is it. These are 3 of the most important things to reduce the risk of sustaining concussion. 1 is be an aware, skilled player. Recognize high-risk plays. Perform all skills with awareness of your surroundings and keep your heads up when you can. The higher your skill level, the lower your chance of concussion. And take and receive contact responsibly. Secondly, optimize your endurance. Increased endurance results in optimal skill and game awareness, which results in decreased concussion risk. And lastly, advocate for and adhere to the rules of the game. Don't participate in things like dangerous and illegal hits and fighting. These are 3 of the most important things to optimize recovery and management of a concussion. Firstly, and most importantly, seek help as soon as possible. We know the best predictor for shortest recovery is seeking help from a licensed healthcare provider for an assessment of your concussion as soon as possible, which is optimally less than 3 days. Do not return to play that day. Secondly, be a positive change in the hockey culture. Don't use terms like getting your bell rung. Take head injury very seriously and support your teammates going through concussion recovery. Lastly, stay educated and aware. Recognize the wide variety of signs and symptoms of concussion. Understand the importance of staying off the ice and educate your teammates. My first of 4 quick take-home points is to seek proper assessment early. That can't be said enough. The number 1 predictor for fastest recovery is being evaluated by a licensed healthcare practitioner soon after injury. Secondly, it's important that you actively participate in your concussion rehab. Focus on the things that you can control. Listen to the advice from your medical team. Remain part of the team culture. So attend games, practice when you're cleared, perform your concussion rehab on the sidelines, and simply observe the game. Study movement of the players and use visualization. Thirdly, understand that a resolution of an athlete's symptoms does not clear them to return to play. A concussion is a metabolic crisis in the brain which lasts for approximately 22 to 30 days. However, your symptoms may resolve before this. Returning before causes an increased risk of more severe brain injury, prolonged recovery, irreversible damage, and other non-head related injuries. So returning to play before being properly cleared not only increases the chance of further head injury, but also other bodily injuries. And why is this? An athlete suffering from concussive symptoms will have poor reaction times, decreased peripheral awareness, decreased visual tracking ability, reduced processing speed, poor strength, and poor memory, which all are things that increase the risk for all types of injuries. Lastly, the easiest thing we can do is support each other. Concussions aren't as visible as other injuries, so be sure to respect where your teammates are in their recovery journey, regardless of how they appear. Put trust in your coaches and medical staff to make the right decisions. We want healthy humans and healthy hockey players for life, so take brain injuries very seriously. Thank you very much for taking the time to review this presentation. Best of luck in your season. Have fun and be safe. Thank you.